Hi, this is Susan Brown at the Center for Better Bones. I'd like to share with you a case I saw just yesterday. It was really pretty interesting. A 58-year-old woman came to me frightened, very frightened, because her doctors told her that she had to take bone drugs. She was very likely to fracture. She wanted to know what she might do to improve her bone health. In this case, it was very interesting. So looking at her situation, we saw that she was indeed 58. She had gone through menopause 5 years ago. So she was right at the tail end of that rapid menopausal bone loss. And that she had slipped into osteoporosis. Her bone density was minus 2.5 in the spine, although the hip was somewhat better. The doctors, of course, when they saw the 2.5, minus 2.5, a T-score, they said, oh, you should go on drugs. But when you look at it more carefully, you see that she didn't have a single risk factor. She had not fractured. No one in her family had fractured, not parents, not grandparents. She had no other health concerns. She was not taking medications for steroids, which might damage bone, or antidepressants, or any medications that might damage bone. In fact, her FRAX risk assessment, as done by the bone density test, said that she was at very low risk. However, her doctor still persisted in telling her she should take drugs, and she subsequently was frightened. When we looked at her case, we saw an interesting thing, though. We saw that it would be very wise for her to do the Better Bones program completely, to try to ensure that she'd maintain some strength as she aged, but more importantly, because she did have a health concern, and it wasn't osteoporosis. It was really a situation of hardening of the arteries, calcification of the heart arteries that was detected by a physician when they detected high cholesterol. In her case, they actually did a quite fancy test, which is an X-ray, a CAT scan of the heart, to detect calcification and deposits in the arteries. And indeed, she had a very high amount of calcification for a woman who was only 58. While the doctors don't know why that happened, we certainly found it very interesting. And the point of this case was her concern was really not bone health, although she was very frightened about her bone. I could assure her that wasn't the important issue. The important issue was to work on this question of arterial calcification. And as it turns out, the Better Bones program is, with the 20 key nutrients, with the alkaline diet, is excellent, with the exercise, is excellent for a heart situation. And those of you that have followed my work will know that what nutrient stands out? Vitamin K in the form of MK7, which has been shown by the major researchers to actually begin to significantly reduce arterial calcification. So in her case, she was delighted. I could assure her that bone health was not her greatest issue. It really wasn't a concern. She needn't be frightened about that. She could go on to develop strong bones and keep her muscle mass, but that she should pay good attention to this arterial calcification, and she could do it using all the 20 key nutrients in the Better Bones program, including the MK7. Sometimes things aren't as they appear. Always good to sit back and take a second look. This is Susan Brown, Center for Better Bones. We'll be talking to you soon.